30-minute sessions that we have, so when people are done with the evaluation, they're gonna go into a med management session. When they come in, you're gonna click in, and first one is going to be history. It's obviously past and family history. If there's any changes, yes, I moved, yes, I'm homeless. Review of systems, just like the evaluation. You're gonna go in, click, and then move into your examination. So again, you have the narrative options where you can put in that, and we can get a template for you if you want to do that, or you can do the click boxes. And then assessment of muscle tone and complete. Here's your med note. This is going to be your HPI, your impression, your plan. So for the HPI, it looks kind of funky, but you're going to come down here. There's always notable changes because that's why we're here. So you're going to put in your HPI. Substance use history, you're welcome to do this one if you want. I usually put substance, either a really quick note, alcohol, sometimes I'll put a note. If you press notable, there's going to be a little drop down box, and you can discuss that. Risk of harm to self or others or property, this is just like the eval, but it's required for every meeting, just to review. You can roll through that really quickly with them, and again, this is takes meds as prescribed. This is an additional, it's kind of something that you would see in the HPI. If you want to bypass that in NA, you can, or you can utilize it and say, yes, he does take it as prescribed, yes, it's working, or no, it's not, these are the reasons why. That's optional. You can do that if you want. PARQ, yes, I did. If we're billing for counseling and coordination of care, we should always be clicking this to identify that, and then as you can see, you have lots of room to document in these two. This is your impression. Oh, sorry. You're putting your impression in, and then plan, and that's populating right there. And putting in kind of medication, continuing Zyprexa, continuing the treatment plan, going to request AOP services, whatever is in your plan. If we are doing a 99214, it's good to put in right here that plan that, or in the impression, provided therapeutic listening, provided education on blood sugar, or reviewed labs, whatever the coordination of care efforts you made in the session or are going to make in the future. Next meeting, plan to talk about, we discussed that we would review the labs that I requested today, or the plan. And that actually helps guide you for the next session. You can pull up this note and say, okay, that's what I remember what went down. That always helps to guide me. Is this a medication change? They do require this, knowing this. And if it is, yes. If it's not, no. And again, this is in the eval, we had talked about going into the client intake and the little stethoscope and identifying the start new diagnoses. If you decide at this point in your med management session that you want to start a new, so you believe at this point this is not depression, this is bipolar 2, you can put this in. But if you don't, this section for E&Ms is just going to be this wacky cut and paste thing. So you're going to copy, paste right here to say, yes, I still agree with adjustment disorder, with depressed mood, and click here, yes, they still meet criteria to continue care. Um, right here is the add-on, the counseling coordination of care. So when I say it's a 99213, so it was a 15-minute session, and I didn't talk about any, the 15-minute session can never be 50% of the visit spent on psychotherapy, since it doesn't meet criteria per DMAP. So we put no. If, however, we did our 30-minute session, or the 21-minute to 30-minute session, which is our 99214, we click on the yes, because we've identified that 50% of it is counseling and coordination of care. Complete. Interactive complexity. If there was, if a clinician needed to deal with any of these factors, we're going to put yes. If not, no. It's an extra billing code. And then were you telemed? I was not. And then we're going through here. We're identifying, just reviewing. No, I didn't have an ecotherapy. Counseling and coordination of care was not, because it was a 99213. You can adjust it right there too. And it was actually not 30 minutes. It was 15. So, which would be that. It was a really quick, easy session, which I rarely have. I usually have the 992